Pregnancy and having a baby bring about big changes. Because of these changes in your body and in your life, there are things you need to know about your mental health. The period of time which includes pregnancy and 1 year after giving birth is called the perinatal period. Up to 1 in 5 women struggle with their mental health during this time. And the most common conditions are depression and anxiety. Depression and anxiety are different from normal sadness and worries. Normal sadness and worries disappear over time, but depression and anxiety last longer and impact your day-to-day life and sense of well-being.
How do I know if I have depression or anxiety?
You may experience some of these general symptoms. You may be depressed if you often feel sad or don't enjoy doing the things you usually enjoy. Also, you might sleep more or less than usual, feel like eating more or less than usual, always feel tired, have trouble concentrating, have low self-esteem, or have feelings of guilt. If your depression is very serious, you may even have thoughts about not wanting to live anymore. You may have an anxiety disorder if you often feel nervous or anxious, or you're unable to stop worrying, and this comes along with bodily changes, such as nausea, trembling, dizziness, or trouble sleeping. Some people may experience both depression and anxiety at the same time.
I have been feeling many of these symptoms, but I'm not sure if it's just because of my new baby.
During pregnancy and postpartum, figuring out if you have depression or anxiety becomes complicated. Symptoms of mental illness can show themselves in particular ways that are different from usual. You may feel overly worried or anxious about the health of your baby. Sometimes you might not be able to sleep, even when the baby is sleeping. Or you may feel uninterested in your baby. You might have feelings of worthlessness and wonder if you're fit to be a good mother. You may have unwanted and upsetting thoughts, especially about your baby, or a flooding of traumatic memories. You may be more irritable than usual. You might wish you could be somewhere else, or have thoughts about escaping your own life. Not everyone has all the same symptoms. Cultural differences and lifestyle differences mean that different people will experience different symptoms in different ways. If you have several of these symptoms, and they happen for most of the day, almost every day, then you might have depression or anxiety. Remember, these are very common conditions to experience during the perinatal period, and no matter your situation, it's not your fault.
I do feel like I'm going through some of the things you've mentioned, but I thought that pregnancy and having a baby were supposed to only make me happy.
That's a myth. In fact, you can really want a baby and be really excited, but still have sad thoughts and struggle with mental illness. If you think that you're experiencing symptoms of mental illness, then you should talk to your healthcare provider, such as your midwife or your doctor. It may be hard, but it's important to talk to someone who can connect you with treatment to help you feel better. Feeling better will help you, your baby, and your family thrive.
Please take care of your mental health by telling a healthcare provider how you feel if you're experiencing some of these symptoms.